All right. Well, welcome everyone. Thanks so much for joining us today for our second topic in our Community Conversations with Poverty on Poverty series, Lessons Learned in COVID-19, co-hosted by the Division of Social Accountability and the Saskatoon Poverty Reduction Partnership. The DSA, as a unit in the College of Medicine at the University of Saskatchewan, is located on Treaty 6 territory and the homeland of the Métis. And the College of Medicine works and partners with communities, clinical faculty, and students learning on Treaty 2, 4, 5, 6, and 8 and 10 territories. We acknowledge the Indigenous people as ongoing and current stewards of this land. And wherever you may be joining us from, please do your own silent acknowledgement of the traditional people who inhabit the territory where you live. And my name is Erin Wolfson. I'm the Community Engagement Specialist with the College of Medicine at the University of Saskatchewan. And throughout the fall, we're joining together every Friday around this time to discuss lessons learned during COVID and how these intersect with the 12 bold ideas to eliminate poverty, as well as how to move forward. If you want to see any of the past recordings or learn more about future sessions, you can find us on more information on our website, which I'll put in the chat, or Joanna, if you mind doing that as well. And if you have any questions about WebEx or anything like that, or any suggestions or ideas for future conversations, please drop us an email. And I'll also put the email in the chat. Just briefly, I'd like to quickly acknowledge my colleagues, Joanna Winnichuk, and some of our IT support, Tyler and Nate, who are providing some of the behind the scenes admin support for this webinar. So thank you so much. Today, we are joined by the Saskatoon Housing Initiatives Partnership, or SHIP, to discuss issues of housing insecurity and homelessness and what COVID-19 taught us about the Homelessness Action Plan. We chose today to speak about this really important topic as tomorrow, October 10th, is World Homelessness Day, recognized annually to draw attention to the issues of homelessness globally. Before we hand over the conversation to our conversation hosts, Lynn and Priscilla, just want to introduce my co-host for the series, Colleen Christopherson-Cote, who is the coordinator of the Saskatoon Poverty Reduction Partnership. Colleen, did you want to say anything about this topic or anything about?
No, I think I'm here to support the colleagues at SHIP to talk about this work, and then maybe to answer any sort of connecting questions back to the 12 bold ideas or some of the work that's been happening over COVID. So I'll just sort of stand off in the sides for today. But thanks for hosting this with us.
Perfect. All right. So I'd like to introduce our hosts for today's conversation, who are both coming to us from SHIP. And I will let you, Lynn and Priscilla, share more about what SHIP is, if that's okay. So Lynn Brown is SHIP's Executive Director. Lynn has provided leadership to a variety of community-based organizations during a career that spans 30 plus years and includes Saskatchewan's 3 largest cities. She's a strong advocate for change brought about by meaningful dialogue and community collaboration. Lynn works diligently to provide innovative ideas to the forefront. In a recent position with Spinal Cord Injury Saskatchewan, she was able to encourage individuals with lived experience to volunteer and participate in the first ever Saskatchewan Artists of Abilities Festival. The festival provided an opportunity for artists with a disability to showcase their work to all artists and audiences, featuring innovators in disciplines such as theater, performance art, dance, music, visual art, and media. Other sector areas of experience include domestic violence, early learning, and childcare, as well as food security, poverty reduction, and homelessness, as well as a short time with municipal government. So thanks so much, Lynn, for being here with us today. As well, we are so pleased to welcome Priscilla Johnstone, who recently started with the Saskatoon Housing Initiatives Partnership in September as the Homelessness Action Plan Manager. Priscilla has extensive experience with the urban and rural community sectors and all levels of government. She's worked for many years with the Saskatoon Health Region and as a police officer both in rural and urban settings within Saskatchewan, as well as managing a drug and alcohol transition home for youth aged 18 to 25. Most recently, prior to this current position, she was the health center manager with Saskatoon Tribal Council. Just quick housekeeping, we do have a chat function, which is, I don't know, side is on the right hand side of the screen, it might be on the bottom. So please do use that and share any questions or comments that you that come up for you, and hopefully we'll have ample time to have discussion. So without further ado, I'm going to hand it over to Lynn and Priscilla.
Well, thank you very much. It's a pleasure to be here today. It's a pleasure to talk about what we do at SHIP. And I'm actually going to take a few minutes and just talk about SHIP from the perspective of what we do and how we came to be before we start to get into the depth of the COVID and homelessness experience that we've had over the last few months. SHIP was created in 1999 to assist with delivering affordable housing units in Saskatoon by working with private sector, builders, developers, along with affordable housing groups. And of course, we still do that. We are still a provider of technical assistance, capacity building, and community advocacy for affordable housing in Saskatoon. But we are also the community entity for the Reaching Home funding, both the designated communities and the Indigenous homelessness funding streams. Reaching Home is aimed at preventing and reducing homelessness. It provides direct funding to communities across Canada to support their efforts in developing local solutions to homelessness. Over the period 2019 to the end of March 2024, Reaching Home will have provided over $15 million towards reducing homelessness in Saskatoon. And that actually was my sort of first experience. I started here as executive director on March the 9th, and within a week of that start date, we were in the midst of the urgency of COVID-19. And so understanding the Reaching Home funding and then receiving an additional $2.5 million of funding from the federal government specifically for COVID was one of my first experiences. And as we received that funding, and of course I'm so new, I'm putting my hands up in the air and I'm thinking, oh my goodness, how do we get this out to the community so that we can be effective at mitigating some of the concerns and issues around the COVID piece. And so we were able to utilize actually the collaboration of the Interagency Response in order to access some of the information of those agencies who were specifically concerned with housing and homelessness and what some of their needs were. And in so doing so, we were able to bring to the forefront those needs to our Community Advisory Board, who then made the decisions for us to go ahead with those organizations and their requests for funding to specifically meet COVID-19 challenges and needs. Some of those funding needs were around PPE or extra cleaning or developing more shelter space because of social distancing and the need for that. Some of those needs were also around case managers and increasing intensive case management capacity, transitional housing, and so on. And so because of the assistance with the interagency group and the capacity for us to collaborate, Saskatoon was the first community in Canada to have the COVID funding into the hands of the community agencies the most. And so for that was my first experience. So I hadn't even gotten into some of the real challenges around, oh my goodness, we have people who need to social distance. We have people who need to wash their hands and they're homeless. So, okay, what do we do next? Once again, the interagency collaboration sort of came to the rescue. We were able to develop the sheltering branch of the interagency group, and we were able to work towards the different partnerships that allowed us to mitigate some of those issues. And so as we developed those partnerships, we realized that there needed to be a strategy of people when they would come out of hotel, for instance, and make sure that they weren't just sent into homelessness. So we were able to partner with the Housing Authority to receive a handful of their housing stock, and we were able to transition people into those housing stock. And at the same time, SHIP as an organization was able to bring on 2 case managers as a result of the extra COVID funding from the federal government. And then we were able to start to house people on a more permanent basis once we were able to work with them in the transitional housing units with the Saskatoon Housing Authority. The collaboration and the partnership was absolutely incredible throughout the whole interagency response and work. And I'm going to stop there actually, because I want Priscilla to just jump in and talk a little bit about some of her experience at that time as well. At that time, Priscilla was working with, she was a senior manager with the Tribal Council Health Center. And so I know that she has a piece of something to add that may not necessarily be SHIP related, but could talk a little bit more about interagency response. And then after Priscilla is finished, I would like to talk a little bit more about some of the challenges from other aspects of COVID issues. So go ahead, Priscilla.
So you must be muted.
Hello. I apologize for that. Can you hear me now? Okay. Sorry about that. Yes, as I had mentioned, I'm new with SHIP, and previously I was working with the Tribal Council as the manager of the health center. And like Lynn, I had started on March 9th as well this year, and then a week after COVID occurred. So my biggest, I think the biggest thing for me was a huge learning curve in regards to COVID and the pandemic and how to properly mitigate trying to stop the infection of COVID, especially coming from a health center. And we're dealing with a lot of people within the community that had already barriers that they were already facing. So it was just one more barrier it seemed like they had to try and mitigate through. So it was very difficult because we had to close to the public. So we also operated the needle exchange program. So that was the only portion of our service that was available to our clients. So it was extremely difficult. But as Lynn had mentioned in regards to the interagency, I'm very thankful and grateful in regards to the city of Saskatoon of how we could all come together as one huge team to try and help and support one another. And I think for myself and some of the clientele that we work with at the health center, I think if we didn't have that foundation of collaboration and support from the community, we wouldn't have been able to properly help and assist the clients that we were serving at the health center. So I'm extremely proud and grateful for the work that we've done thus far. And now that we're still in COVID, and I don't think we're out of the woods yet, I think we're potentially coming into that second wave. But there are still problems in regards to working with some of our most vulnerable population and trying to get them into secure housing. It's extremely difficult. And now with the new position that we're currently in, I myself see more first at hand in regards to some of those barriers that some of that vulnerable population are now seeing. So I had a different perspective previously from a health viewpoint of the infections of COVID and the potential spreads. So coming from that perspective and then coming into the housing perspective is different, but at the same time, they're all connected. So my my viewpoint is, and how I see things has expanded, but I also see some of those areas where there was previous barriers, but I see now how we can more mitigate as a team and try and help and support that vulnerable population as best that we can. So I'm like Lynn, I'm very grateful and happy for that interagency, and I think that moving forward, we wouldn't be able to do it on our own, and that team approach, we need them to move forward in regards to try and help mitigate some of these challenges that some of our vulnerable people are facing and try and eradicate homelessness the best way we can, keeping in mind that I don't think we can eradicate all of it tomorrow. I think it's just going to take some time. Thank you.
Thank you very much, Priscilla. As I was thinking and sitting back a bit as Priscilla was talking, I was contemplating some of the things that were brought to light with regards to our current system challenges. And I think they were brought to light because many things were exacerbated by COVID-19. I know that from observation, it was clear that there were more individuals who were ending up in challenging homelessness situations. There were youth, for instance, that had been precariously housed, staying with family members, for instance, and couch surfing, and who were no longer able to do that because they either felt on their own voluntarily that they didn't want to possibly expose older members of their family who they may have been staying with to the possibility of COVID-19, and so they chose to be homeless. We also had those individuals who, as family members, and they were older family members, may have asked the youth family to not come back and expose possible exposure to the virus. And so one of the things that the Reaching Home funding had accomplished was to work with White Buffalo and to establish a temporary youth shelter. That end result, of course, is a positive aspect, as we were able to have funding to be able to do that. But the thing that I was most disappointed with in some of the conversations that were going on, there was information that I became aware of that I wasn't when I first started the position. And I didn't realize that in the province of Saskatchewan, that for the city of Saskatoon alone, we receive regularly per year about $2.5 million of Reaching Home funding. And across the country in Canada, every other province in Canada is matching the Reaching Home funding that is focused on reducing homelessness in the varieties of communities. And so that was very disappointing to me. The other things that were disappointing were really from a provincial level as well, and a lot of it had to do with communication. Sometimes it seems like there were decisions that were made in haste that didn't necessarily have the best outcomes for the homeless population. And they were often made without consultation. And it seemed as well that they weren't listening, even though we tried to have conversations with the Minister of Social Services, and we would put forward our views from the Interagency Response, not just from a SHIP standpoint, around things like direct rent and, at the end of the day, once the moratorium was lifted on evictions, did that mean that we were going to have more families that were going to be facing homelessness and crisis? And of course, that is indeed what happened. And I do know that, and this is where I'm going to ask Colleen just to speak up a little bit. I know that there was a number of opportunities where we had a chance, the Interagency Communications Group, to speak with the minister. It still seemed as though we weren't getting that appropriate ear, and I just wanted Colleen to talk a little bit about her experience with that.
So it's always interesting to talk about government funding in a time period where we're in an election. So one of the things that I get to talk about, because I'm a third-party contractor, is that sort of freedom to talk about what's going on provincially right now. And so I think early on, it was very obvious to us that we needed to advocate to provincial government for supports. I think even if we talk about the incident command structure that was being created over this process as well, advocacy isn't really part of incident command. And I think, I know Deb is on the webinar too from EMO. We had lots of conversations around advocacy and why it needed to be embedded in this work. And early on, the province would come to the table and speak about potential connections, but nothing ever really materialized as far as funding goes. And we are, like Lynn said, the only province in Canada that doesn't have some degree of matching for Reaching Home dollars. We're also the only province that's clawing back its CERB benefits from income assistance. And so this province is quite notorious for consistently saying that they are the last resort funder and that people need to exhaust all avenues of other funding, including private donors and community-based dollars, before they're willing to come to the table with potential funds. And so it was highly problematic throughout the entire Interagency Response. And it really just sort of left that funding conversation on the doorstep of community. And so, like good community practitioners we mustered up the need and response and talked to other funding agencies and built a portal so that we could basically just self-fund the response.
Thank you, Colleen. Yes, and speaking actually of the funding portals as well, that one of the other things that I certainly appreciated was the collaboration from other funding agencies such as the Community Foundation and United Way, and their capacity to meet some of the needs that were coming up around the lines of PPE, extra cleaning, extra funding for different aspects of the organizations that needed to access funding in order to be able to meet those needs. We had some successes, certainly some successes as well. I know that through the Reaching Home funding, we were able to bring forward transitional housing units for individuals who would have been or were being actually discharged into homelessness through the justice system. Because that was the other piece too, was there was a lot of talk within the groups as we had our meetings about how we needed to prevent the discharge of people into homelessness from systems. And so it was a positive aspect for us to be able to provide funding to an organization that was able to at least mitigate that in some small way. I had already mentioned the youth shelter, and that was also a positive piece for us. Our case managers that we were able to hire through the COVID funding that we had were able to house, and they actually weren't able to come on stream until the beginning of June because that's when we had those positions put in place, and they were able to house 41 people from the beginning of June till now. They are still working with us, and there is going to be a second injection of Reaching Home funding into the community of Saskatoon. We've just gotten word on what that funding looks like. There's about $365,000 coming into designated communities and another $793,000 coming for Indigenous homelessness. And so we will be going back to those organizations that were initial receivers of funding specifically for their COVID-19 partnerships. And we'll see if they're in need at this point of funding to be able to continue. And that is the goal of the funding, is to ensure that those projects that were started to mitigate challenges with COVID-19 in the homelessness community are able to continue and still have effect. I think that there's probably concern at this point, and valid, that we will be looking at a second wave. Our numbers in Saskatchewan seem to be going up somewhat, so we need to be prepared for that. And it is critical that we don't suddenly put ourselves in a situation where we're providing effective programming to the homeless population and then have that programming have to end abruptly because of no funding. So we're very grateful for the injection of extra COVID-19 funding. There's also been $1 billion put into a rapid housing program. That funding will be accessible through CMHC and FCM, and that is specifically for mitigating homelessness by allowing agencies to purchase property which can be renovated and utilized for affordable housing or supportive housing or transitional housing. I wanted to actually ask Priscilla if she could talk a little bit more about some of her work most recently for SHIP in the community and some of the feedback that she's gotten from the organizations she's talked to around either COVID funding that they were receiving and how they've been able to work in the community with that, or even the other Reaching Home funding that we also have access to.
Thank you, Lynn. So, like I mentioned earlier, I'm still very new, and my first approach to get myself familiarized is I wanted to get out into the community and start meeting some of our community partners and have a better idea as to what type of services that they're providing within the city. So at the same time, looking at past proposals and what they've been offering. At the same time, looking at the COVID situation and to try and assist or mitigate, or at the same time just have a better understanding of what's happening from the community perspective and how all of our community partners are being impacted by COVID, as well as our population, and how we can better utilize and support them in the transition that we're currently faced with right now and the uncertainty. So for me, that is a big step in how I'm trying to get out there and have that better understanding. So what I've learned thus far is that every community organization here within the city is trying to do the best that they can to help and support the vulnerable population within the city. At the same time, there are a lot of unforeseen barriers in regards to trying to stop the spread of COVID, right? So that's greatly impacted the services that can be brought forth to our vulnerable population. With the distancing that we have to take into consideration, the stop in the spread of the infection. One of the biggest things that was kind of brought forth is specifically one of our food security programs that we have in the city. Their numbers and for the amount of people that they can bring in to actually provide that meal service has greatly impacted how many people that are actually being served. So how to mitigate that so that we can still provide those services for our vulnerable population, but at the same time having to work through and trying to mitigate some of those barriers. So the issues and the problems are real. And that was one of the biggest things for myself, was to have that firsthand account of what was happening. So I've made it a point to try and visit with every community organization thus far. And one of the biggest things that I kind of brought back was seeing firsthand what some of those challenges were already. And not just in regards to COVID as we currently are right now, because I think everybody is facing some similar challenges across the world. But one of the biggest things is that I seen was that I wasn't aware of all of the wonderful programming and services that everyone was doing this far. So I was completely amazed at how, specifically for the city of Saskatoon, how much wonderful work that we're actually already doing. And I found for myself that was kind of one area that as organizations, we don't freely share all of that positive work that we're already contributing and what we're already doing. So that was one thing kind of from the outside coming in, being able to look at everybody's program. I'm completely amazed at just how much wonderful work that we actually already are doing as a city. And I think now with the new program that we're trying to implement with the coordinated access, I'm hoping that that's one area that we can bring everybody together so that everybody as a collective can see all the wonderful work that everyone is doing thus far within the city of Saskatoon. At the same time, carrying on within that spirit of the interagency response and working together to try and combat COVID and try and mitigate so that our numbers don't get as high. I think if we move forward with that same type of teamwork approach, I really believe, and this might just be too optimistic on my part, but I think that we could really, really have a great chance in eradicating homelessness. I think that is one of the biggest takeaways for me personally from COVID and being able to come together as a team and with the interagency. So for me thus far, that's what I've learned, and those are some of my takeaways, and that's it for me. Thank you.
Thank you, Priscilla. I also think that there were some very innovative ideas that came out of the past 6 months or so because there were things that could no longer go on in the same way that we were used to. One of those sort of activities was case management and counseling with families. And so we had two organizations who received Reaching Home funding who were able to develop a online program which could provide counseling. And so they were also able to provide to each of their families who had been previously accessing their services through our funding opportunity. They were able to provide Chromebooks and technology that would allow them to access online case management, online counseling, and be able to reach out to people without actually having the face-to-face in the same area, which would then put individuals at risk for virus infection. So innovation was something that it was also exciting to see people coming up with new ideas. What I saw with the interagency group too was the capacity to collaborate was exceptional. I think in the 30 some odd years that I've been in the not-for-profit sector, I have never seen such a capacity for organizations to come together and to collaborate at what felt and still feels, quite frankly, at a sort of an invisible enemy, and one that had the ability to cause great harm to people and their families. And so just being a part of that was, it gives me goosebumps to think about some of the calls that I was on where people were so focused on partnering and collaboration in order to strive to make meaningful difference for our homeless community. And so that for me was actually an exceptional experience that I'll never forget. But as we look at where we need to go in the future as well, and not just because of COVID, but in order to really meaningful tackle the homelessness challenges, is we need to continue that collaboration. We need to continue talking as partners, and we need to focus on the enemy. And we need to continue to make sure that there's a difference. We need to ensure that we hear the voices of those with lived experience before decisions are made. So those voices need to be brought to the table. We need to ensure that our organizations are culturally competent and understand the various cultural activities and languages and responses that are needed to be able to fully meet the needs of the community. Actually, and with regards to that, there is something that I wanted to just mention today too, that one of the case managers who is employed by us here at SHIP also sits on the Lived Experience Network, Canadian Lived Experience Network. And they have now launched a website today. Today is their launch day. They're quite excited about that, and they're looking forward to being able to get information out in a very smooth way with the website that people can access and go to and interact with. I do actually would like, I know, Colleen, you mentioned just very briefly the term CERB, and that is also a piece that we're still working on and has some ongoing aspects of it. So can you give us just a little bit more on the CERB project and maybe some preliminary numbers if you have them off the top of your head?
So I don't have a ton of preliminary numbers. I can put in the chat some information that comes from the federal government. We've done some sort of deep dives into CERB dollars that have been, or CERB recipients that have been captured by StatsCan data. We're also trying to figure out mechanisms to try and get access to some provincial income assistance data, but that is proving a little bit troublesome, particularly also because we're in a RIP period, and so things are a bit slow with the provincial government right now. But basically, CERB, or the Universal Basic Income support that's been provided by the federal government, has been posing some problems, and we saw those problems starting to rear their head early on in the interagency response, and have worked with some of the frontline agencies who are working with clients who have ongoing income assistance pressures. And so we actually have a CERB team of agencies who are quite interested in tracking what's been going on. That team is functional right now, so if you're interested in getting connected with CERB work, you can connect with me. I'll throw my email address into the chat after. But also that team, in talking with people, and there's a community survey that we put out to see what people's pressures were. There were a couple of deliverables that came from that conversation. And so one of them is a one-pager that Prairie Harm Reduction graciously has put together around the things that they've learned on how to navigate it. So if you have clients that are CIS or SED clients and they are somehow connected to CERB, either they've received it or they're having sort of complications around the CERB and provincial connections, there's a one-page document that explains, the processes in which to talk to income assistance provincially around what you should be asking them and all those kind of things. That document goes to the committee today and should be ready to be shared beginning of next week. And the other thing that we're doing is tracking where in this community people are supporting income assistance requests and supports for clients. And so kind of on the same concept that Priscilla was speaking about is that we don't always know what each other's doing, because quite often, in particular because of COVID, we have our head down and we're just working. There's so much work to do. And so what we're asking people to do is let us know, do they support clients who are having income assistance problems? And if they do, to tell us what they do, what kind of clients that they support, times a day that they operate, and those kind of supports. And if they don't, we will then provide them with this one pager that says, if you have clients that are coming into your system that you don't know how to support with income assistance questions, here's where you can go to get accurate information. Because right now, I think a lot of people send their clients back to Second Avenue, and the direct connect to the ministry itself isn't always the most productive connection for folks. And that connection point doesn't always equate to getting what people actually need when they need it. And so we're trying to build a structure in the community so that people know where to get access to information and who might be able to help them navigate this. I suspect there'll be more CERB-related, federal benefit-related funding calls in the immediate future coming from the federal government, and so we need to be cognizant of the impacts that it's having. We also know anecdotally at this point, but we're still collecting some information and talking to some other researchers around the implications of a universal basic income and the implications of it being so easily accessible, and what that's going to do for folks who may or may not have been eligible to receive it. And also the implications around taxable benefits, which is something that many of the folks that are being supported in community don't have to deal with on a regular basis. And so the implications around taxation become problematic as well. And so there's all these pieces that we're trying to unpack so that community practitioners and frontline agencies have the most accurate information to support their clients.
Thank you, Corey. One of the other things too that actually happened because of COVID-19 is we were forced to cancel our pit count, which was scheduled for early the spring of 2020. And so that means that we don't necessarily have the most up-to-date information either. We're dealing with information that comes from a few years ago. And so we are looking at doing a pit count in the spring of 2021, provided, of course, that it is safe to do so. Preparing for the fact that it may not be, and then we might be looking at fall of 2021. But hopefully that will also provide us with information that we can utilize from a statistical purpose as we move forward. From a SHIP standpoint, we've also hired a media individual who will help us get information out when we have information that needs to get out to the community. We will be starting to report more so around the Homelessness Action Plan and what we've been able to accomplish towards completing that plan and that mandate, even in a COVID time. And so we've also moved forward with HIFIS, and we've hired a new individual who is working with the HIFIS program, which will also help us in the future, because as community agencies engage with HIFIS, we will be able to have generic reporting that can speak to the status of our community and where we're at around homelessness and the challenges and so on. We're looking at doing some sort of analysis of our SHIP board as well as our community advisory board. We also feel that ensuring that we are representing our community, and when we look at our community, the most recent statistics we have show that the homelessness community is typically 85% Indigenous, and so we want to ensure that we're making decisions from an Indigenous lens and with Indigenous voices. So that's also where we're going forward in terms of the future. Priscilla, did you want to add a little bit more with regards to that? I know you and I have had lots of conversations around analysis of the SHIP board and the community advisory board and a need for Indigenous voices.
Thank you, Lynn. I think my biggest issue is that I think that in regards to the position that we're currently at with SHIP and the majority of individuals that we have that are accessing SHIP or that are homeless in our community, yes, Lynn is correct that 80% are Indigenous or Métis descent. At the same time, I don't believe that they're properly being represented. But I also believe at the same time, Canada is a very multicultural country. And I feel that it's imperative that we embrace all cultures in regards to the population that we serve. But I honestly believe that our CAB as well as our advisory, our board of directors should represent the people that we're serving. So I agree with Lynn in the sense that we need to start making some changes in that regard. And I'm very grateful that we have Derek Rope that is assisting us with our coordinated access to help us bring forth a cultural perspective in mitigating how we incorporate our coordinated access. And I know historically, First Nations individuals and Métis individuals have been data to death, I guess is the right way to say it. And there's lots of concerns in regards to the collection of data and data ownership and that type of logistics surrounding culture and stuff. So what we want to do is we want to be mindful of that, we want to acknowledge that, and we want to be able to work within the community to be able to properly bring forth those supports within the community. And at the same time, we also want to represent the community the best way that we can. And that's inclusion of all cultures. Like I said, Canada is a multicultural country. I think it's imperative that we also bring forth that multicultural perspective as well, because not everybody is the same. Everybody has different needs, and we need to be cognizant of that, and we need to be able to work with that. Homelessness is an issue that impacts everybody. It's not just one particular culture opposed to a different culture. Homelessness impacts everybody. So I believe that we could all work together and try to mitigate that. So now we're currently trying to bring forth that cultural lens, that two ways of seeing, and bring that forth. Now, I don't know what that looks like in, say, the months to come, which is why we've brought Derek Rope on the board with us to help us mitigate so that we're properly following protocols and properly making sure that we're doing the right thing. And speaking within our intentions are to work with different cultures as well. So honestly, I believe that we're on the right track, but we're still at the infancy stage and we're still moving forward. I'm excited and grateful as to where we're going and how we're we're trying to be more inclusive and be more cognizant of how we need to provide for our community that we serve. So I'm grateful for the positive changes.
Thank you, Priscilla. If I was going to say the things that are the most important for us at this point and the most exciting in terms of moving forward and based on what we've learned over the last 6 months, is first of all that I am very grateful for the collaboration, the partnership, and so on. And I think that that is going to remain strong. We have continued to meet on a regular basis with the shelter group that was originally established through the Interagency Response. And I also know that there is a Interagency Maintenance Committee that is there in the event that we are thrown back into an intense COVID period, and that it will be possible to reinvigorate the Interagency Response and reinvigorate the collaboration at that level to continue to mitigate COVID-19 challenges. And so if there were any last words I would have at this point, so that we could perhaps respond to some questions if there are some, is that we do need, and I do expect that we will have more collaboration, more advocacy, more partnerships, a more concentrated response, and certainly continued funding support from the federal government. And I couldn't tell, it looked as though there were some things coming in through the chat, Aaron, but I couldn't see if any of them were questions that we needed to answer or anything.
Most of it was me just chattering about resources.
But this is a perfect time, though. I don't want to stop you, but maybe, and if Priscilla has any further comments, if you do have any comments or questions in the chat, this is a great time to enter it.
I don't see anything coming in, but I do have a couple of other things I could say. We are also currently in the midst of the cold weather strategy. We just came through a successful extreme heat strategy where we had to work around COVID-19 as well, because in the summer when we were having extreme heat warnings, and as we move into the winter for the cold weather strategy, we will also be looking at working with places which will be able to provide warm up, but must be cognizant of the social distancing, perhaps the need for individuals to wear masks when they're in the facility in the warm up location. We are just finishing up the posters and some of the information around that, and we'll have that out shortly as well. And so even in those things that we do regularly, our cold weather strategy being an example of it, we are dealing still with COVID-19 and all of its nasty little challenges.
I don't think the chat echo there. I do see some resources. Priscilla, do you have any other further comments, or Colleen?
No, I don't.
I'm not sure if Colleen wanted to maybe talk a little bit about the capacity we have to reinvigorate the interagency response, if need be as well.
I can, but Kayla just texted me and said she's trying to ask a question. Do you want to text it to me? She's like, I typed it a couple times, but it doesn't show up. If you type it into the all attendees, Kayla, is that where it's showing up? Or are you typing it to some random, just the host? You could also just text it to me and I can read it. Oh, Kayla. Housing has become more and more a child protection issue. It's something that they're dealing with a lot. Are there strategies looking at this piece specifically?
I don't have any strategies looking specifically at that piece, Kayla, but as we continue to work to increase the capacity for overall housing opportunity, then certainly families are a part of that, and child protection.
Yeah, I think if I can add a little bit, to see really echoey to you.
It's okay.
Kayla, I think I saw Manuela's name pop into the list. I have had conversations through Saskatoon Poverty Reduction Partnership with the Anti-Racism Network around talking specifically about the criminalization of poverty and how that criminalization process often disproportionately impacts women, but women of color, and particularly leads to conversations around apprehension and sort of the breakdown of family. And so I think those conversations are emerging, and I certainly would welcome the Prairie Harm folks to that conversation. You have a wealth of experience with that. We know that the criminalization of poverty often disproportionately affects women. And so it was one of the pieces from the 12 Bold Ideas that was flagged early on, way before COVID. Yeah, this is talking about policy around rehousing or kids will be apprehended. I mean, Kayla, I think you and I have talked about this, and many of the folks on the line have talked about the disconnect between policy and practice, and the contradictions often between policy and practice, and the idea that we need a policy that provides a framework in which to work within, but there needs to be implementation and practical practices that don't contradict each other depending on which ministry you're working with. And so we know through the housing sector map that systems themselves are often the ones that are perpetuating and creating these cycles. And so having conversations that break down the silos between jurisdictions and the sort of human designed lines in the sand where people say, this is where my ministry's mandate ends and this is where somebody else's picks up, and the disconnect that happens between those lines is one of the things that is like hot on my table from the Poverty Reduction Partnership moving forward. And those pieces particularly were exasperated. They existed pre-COVID, but they were exasperated and illuminated in a way that we haven't seen before during COVID.
I would agree with you, Pauline, in regards to those are some system changes that we need to work together and try and mitigate through. And it's disheartening to hear that they're kind of the envelope is being pushed in regards to what can be done in a short time frame, because realistically, from a housing perspective, trying to get people into housing, it's extremely difficult. And then to have that added pressure, it's extremely difficult, and not really understanding what those barriers that those particular families are facing, whether they're leaving or fleeing domestic violence situations, right? So those are all issues that I believe, like in a housing framework, there needs to be more partnership between us and the ministry, and to try and work some sort of framework so that those individuals aren't being, those families aren't being forgotten. And that's something that I think that Lynn and I, moving forward and with our case managers, that we need to communicate more and start collaborating more and trying to see if we could, close some of those gaps, because obviously those are gaps, and I wasn't aware that it was to that magnitude that where it's currently at. But absolutely, I would agree that we kind of all collaborate together, work together, and let's try and mitigate some of those and try and fix some of those problems.
Yeah, I absolutely support both Colleen and Priscilla with regards to this conversation. So I think we should talk further. And if there's some way to put some funding behind it, then we'll do that as well. We'll look at that as well.
Yeah, I would just add that it's so easy for the general population to point fingers and blame the front line, because the front line is the visible service provider. And we see in media and over the course of this election, both municipal and provincial, that people are creating the diversion that it is the problem of a service provider or the problem and blame on the client. And in fact, if you back up and have a conversation, the concept is around the system. It is not about that specific service provider. And we need to reframe and navigate the conversation back to holding systems accountable for their inappropriate or inadequate implementation of policy. And sort of away from that shaming and blaming of service provision. Service provision is the visible one that is responding to what the system is actually generating. And so we need to focus on higher level system change.
Absolutely. Hear, hear.
I agree.
I think that's a perfect place for us to end. Yeah, this has been so wonderful. Thank you so much, Lynn and Priscilla, for sharing your insights and experiences throughout the COVID response and the important work that SHIP is involved in the area of housing and homelessness and urgent action towards criminalization in Saskatoon and in the province. So thank you so much. And as always, thank you to Colleen for being here, for co-hosting this conversation series with us, and for sharing your experiences with both SPRP and the Saskatoon Interagency Response. Just a reminder that our next session as part of this series will be taking place next Friday, October 16th. Join us as we recognize the International Day for the Elimination of Poverty, which is held every year on October 17th, as we take a very deep dive into understanding the poverty line and the market basket measure. We will be joined by Dr. Chuck Plant, a doctoral research fellow in health and social inequality with the Johnson Shoyama Graduate School of Public Policy at the University of Saskatchewan. If you know of others interested in this topic or in this community conversations on poverty series, please do share this information with your colleagues, your students, friends, networks. Everyone is welcome. And I had already been information. Oh no, Joanna, thank you so much. Shared our website. If you want information about upcoming sessions or want to have access to some of the past recordings, please follow our website. Joanna's also put into the chat our email. So if you have specific topic areas or an expertise that you'd like to share, please get in touch. And thank you so much for joining us. Thanks again, Lynn, Priscilla, Colleen, and enjoy the rest of your Friday and take care of yourselves. See you later.